During my physical therapy appointment, my therapist stopped the exercise and said, "Your weight is making my job impossible. Maybe you should just accept being disabled." I was lying on my back, on the padded therapy table, left knee bent, 90-degree angle, while Kent Bridger pushed against my shin, testing range of motion. 6 weeks after, ACL reconstruction surgery, fluorescent lights hummed overhead. In the small treatment room, that smelled like antiseptic, rubber floor mats, my surgical scar, still pink and tight, pulling with each movement. I'd been gritting my teeth through the discomfort. My orthopedic surgeon had told me physical therapy was non-negotiable. If I wanted to walk normally again, Kent had his hands on my leg when he said it, fingers pressing into my calf muscle, expression shifting from professional concentration to something that looked almost like disgust. "I'm sorry, what?" I tried to sit up, but the position made it awkward. My knee buckled slightly. He stepped back, crossed his arms over his chest, polo shirt with clinic logo stretching across his shoulders. "I said your weight is making recovery impossible. You're carrying an extra 60 pounds that your knee wasn't designed to support, especially post-surgery. Maybe instead of wasting both our time with these exercises, you should accept that you're going to have mobility issues for life." The assistant, who usually worked with Kent during sessions, young woman named Tara, was standing near the doorway, organizing resistance bands. I saw her freeze, hands going still on the elastic straps. Kent continued talking, like he was discussing the weather, instead of telling a patient to give up on walking properly. "I've been doing this for 12 years, and I can tell you, right now, patients your size don't recover from major knee surgeries. The physics just don't work." He pulled out his phone, started scrolling through something. "I have statistics here about obesity and surgical outcomes. Failure rate for ACL reconstruction in patients with a BMI over 30 is 73% higher than normal weight patients. You're looking at chronic pain, limited mobility, probably a knee replacement by the time you're 50. He showed me the screen, displayed some kind of chart I couldn't focus on because my hands had started shaking. I had been a competitive swimmer for 15 years before the injury, starting at age 8, continuing through college, Division II program, partial scholarship. I wasn't swimming professionally anymore at 32, but I still coached youth swim teams 3 evenings a week, worked as aquatics director at the Municipal Recreation Center. My body was strong, trained for endurance, power in the water, built with muscle that apparently Kent Bridger saw only as excess weight." The ACL tear had happened during a master's swim meet in April. Freak accident, knee twisted wrong during a flip turn, felt something pop, made me scream. Underwater, the orthopedic surgeon, Dr. Raymond Cho, had performed the reconstruction using a patellar tendon graft, told me post-surgery. My recovery prognosis was excellent because of my fitness level, muscle strength. He'd specifically praised my conditioning, said athletes like me typically recovered faster than sedentary patients. He'd referred me to Bridger Physical Therapy because they specialized in sports medicine, good reputation for working with athletes, returning to competition. This was my 9th session. Kent had been increasingly critical. Over the past 2 weeks, during session 6, he'd commented my weight was slowing down the healing process, suggested I consider a serious diet plan. During session 7, he'd spent 15 minutes talking about bariatric surgery. During session 8, he'd weighed me on the clinic scale without asking permission, announcing the number out loud, then shaking his head, now lying on this table, being told to accept permanent disability because of my body size. I realized I'd been making excuses for behavior that was completely unacceptable. Kent was still scrolling through his phone, pulling up more charts, statistics, to prove his point about obesity and surgical failure rates. He said I should be realistic about my limitations instead of pushing through exercises that weren't going to work. Anyway, he said he'd seen hundreds of cases like mine. They all ended the same way. Patients giving up, accepting their new baseline. He said if I really cared about my health, I'd focus on weight loss instead of wasting money on physical therapy sessions that insurance was probably barely covering. Anyway, Tara finally moved from her spot by the door, walked over to Kent, said quietly, maybe they should focus on the scheduled exercises for today, discuss concerns about recovery timeline separately. Kent waved her off without looking at her, told her this was a clinical assessment based on evidence, patient outcomes. Giving false hope to patients was unethical. He turned back to me, said if I wanted to continue therapy, he'd require me to sign a waiver acknowledging that I understood the poor prognosis, that the clinic wouldn't be responsible when the surgery ultimately failed. I sat up on the table, ignoring the sharp pull in my knee, asked him if he was serious, actually refusing to continue physical therapy for a post-surgical patient because of my weight. He said he wasn't refusing anything, just being honest about the reality of the situation, something other therapists were too politically correct to say out loud. Then I asked to speak to whoever managed the clinic. Full story is linked below or on my channel.